Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. So today I have Dr. Kerry Fierstein, the CEO of Allied Physicians Group. Thank you so much for joining me, Kerry.
Hi, Jen. It's so great to be here.
It's great. It's great. So I know we were going to talk today about what you're doing to attract and keep clinicians at Allied. But before we do that, I just want to hear a little bit about you, tell everybody for full disclosure that we've known each other. What year did you join Allied?
2011.
Right. So we've known each other since then, and you have become a friend and also are my boss. So we have that dynamic going. And I really love to, if you could tell everybody before I start, asking you some questions, a bit about yourself, your journey, how you got to be where you are.
So my name is Kerry Fierstein. I am CEO of Allied Physicians Group. I am a practicing pediatrician and I still see patients. I've been in Plainview for over 30 years. And as I like to say when I introduce my webinars, I am mother of 3 and now grandmother of 3 as well.
Oh, I love that.
Yeah, very exciting, especially for a pediatrician. People ask, why I went into medicine or, when did I know that I was going to go into pediatrics? So I always loved kids. I was the teenager who was playing with the little kids at the family event while everybody else was, busy eating or talking. So I knew I was either going to be a pediatrician or a kindergarten teacher.
Oh, that's cute.
Yeah. And I ended up going into pediatrics, and I love general pediatrics and watching children grow. And I always knew that I wanted to do private practice and have a say in how I set things up and how I presented myself and my practice to the community.
So it's interesting that if I remember your story correctly, your pre-Allied story, your practice before you joined PHA, didn't your private practice, a bunch of people came from practices that they weren't so happy with to create a new practice?
So Pediatric Health Associates, which is the practice that joined Allied, we formed in 2001. And we had people come from a few different practices to form something that we wanted. And it's interesting because most practices have a senior partner and a junior partner. We were all about the same age, although I am the most senior. Age-wise, at least.
Yeah. But I love that because so often we hear stories about doctors who are just sort of in situations where they're not that happy and they just kind of go with it and they just kind of go. But you guys actually kind of picked up and created your own. What did you guys like about running your own practice?
There are things that are important to you as to how you relate to your patients, what your schedule is, how you're able to set up your personal life. And all of that was important to us. Plus being in a situation where we trusted the people that we were with. I think we were at a point in the practices that we were at that there was a loss of trust for, any one of a number of reasons on a number of fronts. And we didn't feel we would be comfortable staying.
Yeah, so then how did you make that jump to Allied? Tell me about that.
So PHA formed, like I said, in 2001, and we heard about Allied, although we weren't in the original negotiations. It's interesting because none of us had senior partners, right? We didn't have anybody that was in that group at the hospitals or that heard these things. So we weren't part of that initial group. And then we did look at Allied once and kind of said, they're kind of new. Let's give them a little time, see what happens. And then Allied's lawyer was a patient of PHA. And about a year and a half in, he said, you need to look at them again. So we did look at them again. And at that point, we were looking at EMR. They were looking at EMR. So we kind of ran a parallel journey for a little while. And then we got to the point that we saw that the EMR that they chose was something we can live with, because that is a life-changing event for any doctor. Then we decided that we would go with them. And Gary Merkin, who, was the CEO at that point, he jokes that we were the longest engagement they ever had. And I joke that we were well worth waiting.
That's good. I love that. It's funny you said that. It's funny how often the parents of our patients make connections for us. All right. So for those who don't know,
by the way, just whenever I go anywhere in an allied meeting, whether it's an insurance company or a vendor, I would say probably 90% of the time somebody says, oh, I go to one of the allied practices and you guys are great. So it's wonderful.
All right. So for those who don't know, tell us a little bit about Allied. What is it? What's so great?
So Allied is a practice without walls. So we have about 32 practices at this point in 35 locations, I think, because some of our practices have 2 locations. And we've joined together. So we all have the same tax ID number. We all have the same health insurance and retirement. And we had to hit certain marks so that the government would say that it was appropriate for us to be sharing data. And we're able to share all kinds of quality data with each other. And because of that, we're able to negotiate with the insurance companies. And when we started, we always say that we were more states' rights at the time. And again, I wasn't there when Allied started in 2006, but there were about 13 practices. We call them the 13 colonies. And, they very much wanted, they wanted to have local control as much as possible and the benefits of being together. And, over the last 17 years, we've become more and more and more together. I think that started with the EMR, where we were really able to share data and see what was happening in other offices. And then we were able to learn from each other even more.
So you joined, and then how is it that you came in and sort of rose up and now you're the CEO? What qualities do you bring to the table? Where do you think that came from?
Well, like any organization, I always think of Hadassah, right? You need people that want to be active. And if you have someone that wants to contribute, it's very easy in most organizations to get some sort of leadership role. So we started my group from the beginning. I wanted to be involved so we can help the direction, because it was very important to me that Allied grew in the way that I wanted it to grow. So Allied works by a committee structure. So there's finance and HR and IT and quality. Each of our partners joined one of the committees, and I really went to all the committee meetings. So I started on finance because that's where a lot of my personal energy, goes and where my thoughts go, because I was running our prior practice, Pediatric Health Associate. So I started at finance, and then I became treasurer. And then there was a chief medical officer opening. So I ran for that within Allied, and I was elected to that. And then I was working very closely with Gary Merkin for several years. And then he needed to step down for personal reasons. And then I was elected CEO. Excellent. And that's when I pulled you in to be our CMO. Yeah. And you and I have been working closely since.
Yeah. And I love it. And I really love how we have that engagement. The doctors who work there can fill their personal bucket, so to speak, however they want to, right? So some can just get really active in leadership, and others can focus on what they love, seeing their patients, and know that their backs are being sort of covered by their partners who are doing other things.
And we have a breastfeeding division. So we have doctors who then can bring their personal passion to the rest of Allied, which is amazing. And I think breastfeeding and mental health has been a huge thing for us. We have some doctors who really took that on early. Pediatricians, for those who don't know it, have been tasked really with becoming mental health providers for our patients. There are just not enough psychiatrists. There are not enough neurologists to handle the ADHD, the anxiety, the depression. So we've been tasked with that. And some of our doctors really loved it. Some of our doctors were much more reluctant. So we created a mental health committee, and that became a mentoring. And again, that fills the people's bucket who loves it. It makes the other people more comfortable. So it's really been a great model for us.
Yeah. I don't know about you, but I feel like the pace of information that we're supposed to know, like, I don't think I could get through medical school at this point. There's just more and more knowledge base, and there's something to be said for being able to sort of focus a little bit and then have a colleague to focus on a different area, sort of always knowing when there's an emergency and when you need to refer, but kind of zooming in on what you like.
Yeah. And it's not just clinical. I think running a practice these days is incredibly hard. And we saw that with COVID for sure, right? We're making decisions every day about PPE and what people need to wear and what testing we should be doing and what federal programs we can apply for. All of that, I don't know how individuals who are running their own practice were able to make that happen, because Allied, with all of our people and all of our resources, had to work really hard to make sure we addressed everything.
Yeah, that was a particularly stressful time for sure. I wonder if you could, you, Kerry, you come from some pretty strong stock. I think, what did your grandmother live to, like 100 and something? And you faced some pretty significant tragedies in your life. Do you think those experiences have helped you sort of in this role as CEO and getting through COVID, things like that?
I think your family life shapes you dramatically for your future, right? We're learning about adverse childhood events. And, thank God, I don't think I had any. I mean, I guess I did. We all do. But when I look back at my childhood, it was wonderful. And my grandmother, who lived to 109, and she was Hungarian. And, we always would say that I'm peasant stock. That's what my father would say. So we're a strong bunch. And that was helpful. And mentioning my dad was a businessman. So I kind of grew up thinking about business and how do you run it and what's important. And I think that helped me, because a lot of pediatricians, a lot of physicians, right, we focus all on the education and the medical piece of it, which is so important. But nowadays, especially the running of a practice is so important. The margins are so small, especially in pediatrics, that you really have to pay attention to everything. You can't just say, oh, that'll take care of itself. Because if you're not paying attention and you lose that little bit of margin, it becomes a major factor in your success.
Yeah, I
or
think
lack
that's probably
thereof.
why so many people are, people like the idea of being a private practice, but why so many are probably selling to hospitals, because they can't manage that piece of it. So what are some of the challenges that you're facing today as the CEO of Allied?
I mean, one of the major challenges we're facing is getting new pediatricians.
Mm-hmm. Tell me more.
So I was talking about this with one of my partners, and 20 years ago, pediatricians, they graduated and they went into a specialty, which is still, an option: cardiology, neonatal, that kind of stuff. Or they went into general practice. And when you went into general practice, you really had two choices. You went into private practice or you worked for a hospital clinic. And, those were two really very different ways of approaching things. And a lot of people, did not want to work for hospitals at that time and went into private practice. Nowadays, you have pretty much the same group of people, but you have private practice. You have hospitalists now, right? You still have the hospital clinics, and you have the urgent care centers.
Right.
So it's the same number of graduates, and they have so many more options these days. So it's harder and harder to get a pediatrician who wants to go into private practice.
That's interesting. I hadn't thought about it that way, as so many more options like that. And yeah. So what are you doing? If that's, because you have this huge company, right? And I know how hard it is to recruit for our division, our local office. But you're trying to grow the company. You need people. Are nurse practitioners playing into that? Like, what are your strategies?
Like any primary care, I think nurse practitioners, PAs, are going to become more and more part of the landscape. And you have to figure that out because they don't come with the same training. And especially when they're just graduating, right? They've had, a few hundred hours of training in pediatrics versus thousands and thousands of hours that a pediatric resident has. So coming in right off the bat, you have to figure out, well, how do we bring these people to a level that they're comfortable seeing patients and that we're comfortable, letting our families, right, the people that we've been taking care of. And my daughter goes to my practice, so I don't want anybody working in my practice that I'm not comfortable with my grandchildren seeing.
Right.
So what do I do to make that happen? And there is a doctor in Allied who has done a lot of medical teaching in the past. And that's something that she's passionate about. So we're working on an NP training program, which is, just starting in like a kernel of what it's going to be, but it's absolutely starting, and it's something that we're looking to support.
That will be such a draw. I'll tell you, the last couple of mid-levels and one NP, one PA who we hired at our office specifically came because we committed to giving them a specific training, which was, out of the goodness of our hearts in a sense, right? You're basically paying them to train and co-see patients with you because of that, like investing in them up front so that they feel comfortable and that you feel comfortable. And then they can take off, but it costs a lot of money for us to do that, but it's worth every penny.
Right. And then you need to create an atmosphere where they want to stay, right? You don't want to invest in the training and then they decide to go off someplace else. I mean, and obviously everybody should do what's best for them, but we want to figure out to make it best for everybody to stay. So, you mentioned NPs and PAs, and those have to be a part of who we are going forward. But pediatricians and physicians have to be the mainstay of who we are.
Absolutely.
So we have to figure out how are we attracting them and keeping them.
So, the challenge is often that they're looking for salaries. Are you able to compete on the salary line?
I mean, we have to, right? So it used to be that when you wanted a pediatrician, you would call the local residency programs and you would, talk to them, which we still do. And you would place a job on an ad on Peds Jobs, which, we still do. But now we're spreading our net so much further. We're dealing with the search firms, and paying money, right, to get people, and things that we never thought we would really need to do. But now it's much more, I think, when people graduate, they're going in those directions as well. So we're opening our net a little bit wider. We're always looking with all of our employees, whether they're, front desk staff, LPNs, MAs, we have to be at market to some degree. Can we compete with the hospitals on every realm when it comes to compensation? Probably not. So we have to compete in other ways.
Yeah. So tell me about how you make the environment. So, because that's also what we find. We find we're able to get people who are fed up with, they're willing to take a little bit, maybe less in the benefits area or something because of the environment that we create. But so tell me a bit about that.
It's a work in progress, and each person values something different. So the fact that we have more local control at the office level, right? We have managing partners or managing physicians at that office level, and they can have those conversations. What do you value? And I know right now in my office, traditionally, we've always worked 2 Saturdays a month, and we're starting to hear from the physicians that we're hiring that's a lot, that 1 Saturday a month is really what they're willing to do. right? So we're currently doing 2, but we're talking to them. And how do we arrange things so that we can still take care of our patients, right?
Right.
So that's something that the hospitals, for the most part, they work 9 to 5.
Yeah.
Right. And then they're done. And I don't know who takes care of those patients at night. I guess they're supposed to go to the ER. But, our offices want to be open till 7. We want to be open on the weekends. We're working parents ourselves. So we understand that. And I think people that go into our practice understand that, and they want to provide that service to their patients. But it has to be balanced between the physician's life and the patient's life. And there's a little bit of a tug of war there. So we're looking at telemedicine, and Allied has created, and actually we did this even before the pandemic, but it took off during the pandemic. We have nighttime telemedicine from 6:30 to 10:30, 7 days a week. So you can sign out and know that your patients have someplace to go to talk to somebody. A lot of our practices are now using a night nurse for the evening hours, for the weekends. So that gives people some ability to really just shut off and say, okay, I'm now going to focus on my family. But it's not a shift job. It's not an urgent care where you work for 3 12-hour shifts and you go home. But that's the joy of general pediatrics, right? The connections, the relationships with patients, right? We know the number one thing that makes a patient take a vaccine is that their trusted physician tells them it's important. And there's something that we get out of that, out of watching that, child grow, out of doing all the things we need to let them be successful adults and create the society of our future, right? So pediatricians, that's what we've chosen. So, we don't really want shift work. Or we're hoping that enough of us don't want shift work that we can continue to function in the way that our patients need us to.
Yeah. But, it's interesting over the years, one of the changes, like you mentioned, the urgent cares before, it's actually given us, it's a double-edged sword in a way. And I'm just thinking this now, right? On the one hand, it's a competition for the patients in your office. But at the other hand, if you do decide to close the doors at 6 o'clock and somebody has a fever at 7 o'clock, like there are other options, and the patients, you don't have to kill yourself. For the doctors from the old days used to just stay until every single last one was seen. And now really you're not abandoning your patients to let your doctors go home to have dinner with their families once in a while. I remember one of my patients once said, and it wasn't even to me, it was to my partner, but I loved the story so much. She said, "Oh, we're open on Sundays now." And the patient, her response was, "Oh, that's great, but that's not good for you." So when you have enough partners and you could sort of share that workload, so you can give enough to your patient, but also save enough for yourself. I think it is a nice, and it's the balance. It's that constantly renegotiating, like you said, and the voice of the doctors in our offices where, this isn't working for me. Can we adjust here? Can we do this? You don't get that in very, very many places.
For sure. And I know, you just hired somebody, right, who had some personal problems and had to take some time off and wanted to come back and do a lot of breastfeeding medicine, right? Which was her passion and was also a slower pace, right?
And we actually had her. She came and spoke on the podcast.
Oh, she did? Okay.
Yes.
So I'm not outing anyone. So, in the hospital that she worked at, they really weren't interested in looking at any alternative types of schedules, right? At a hospital, physicians really are cogs in a wheel. You just kind of have to fit in, and you have to be little RVU producing machines. And yes, at Allied, we do need you to see patients. We do need you to generate revenue, but hopefully you're so much more than that.
Yeah. And one of the other things that you did to try to foster this positive work environment is appointing me as a wellness officer. So Thank you to that. But really, I mean, it keeps me with my eye on that as a focus when we're making decisions and stuff. So,
Yeah, well, that's part of right following your passion.
mm-hmm.
This became, even as CMO, you were always had a bent towards what does that person need to be successful,
Right.
right? And then when you went more into coaching, this became an obvious place for you. And Allied wants to support our physicians, and we want them to be at the forefront of all of the decisions that we make. And I've said this to you personally, but I'm happy to say it out loud. I've always said you're my conscience, right? Because sometimes my first reaction might be a little more, fiscal or operational. And I've learned over the years to take a little bit of a step back, and you've helped me with that. And we talk about culture, and you and I are lecturing at the AAP conference on culture. And
Mm-hmm.
that's because you taught me, how important culture is to an organization. Even though you can't see it and you can't touch it, right? Culture, we've defined it, right, as what people do when you're not watching,
Mm-hmm.
right? And the expression is culture eats strategy for lunch.
Yes.
So, right, we can make all these great plans, but if we don't have the culture where there's going to be follow through, it's never going to happen.
Mm-hmm.
So our chief wellness officer, our chief experience officer, our chief quality officer, all of the heads of the allied committees, right? We have a dyad system, which is where we have a physician work with a subject matter expert. So we have our HR personnel, but we also have a physician who's in charge of HR, and all of that access to the physician. We're on Teams. Anybody can find me, and they're certainly welcome to do so. And they have, makes it so that we want Allied to be a place to work where you can make changes, not only for yourself, but for the whole, and then look back and say, wow, I did something amazing for my fellow doctors, for my patients that I take care of. The Allied Foundation, right? We know that, this generation particularly wants to work at a place that supports their ideals, that has a conscience, right? And Allied, a group of pediatricians, and I just looked at the list. We are the second lowest paying specialty, I think. We put our money towards creating something that went out into our communities and helped our patients. And we've now given out 2 million diapers.
That's amazing.
Right. So all of these things are help our doctors feel like they're part of something that is bigger than themselves and is more than just a place to go get a paycheck.
Amen to that. That's great. Okay. So while we wrap this up, let me just ask you a couple final questions. First of all, do you have somewhere healthcare, where you see the changes are coming? Do you have any sort of sense of what you see? It's just so much change all the time.
I mean, it's getting harder and harder for individual private practices to succeed. So I think that those who are there and people that are joining, coming out, I think they need a more stable place to work. And that's going to be a choice between, bigger and bigger entities. Mm-hmm. And Allied in that realm is relatively small.
Yeah.
So, I think you're going to need to make your choices about where you want to go, and how what type of organization you want to function within. And, Allied made the choice last year. We joined an even bigger group called Care About, and Care About Health is helping us to go into the next millennium, right? Mm-hmm. With more population health, more integration, and Allied is expanding into adult medicine. And I do think that with value-based care, which is coming, mm-hmm. we need to be able to have that arm, the adult medicine arm and the Medicaid arm, because those are going to be the two places where a lot of value-based care happens. So I think that's a peek into the future.
Yeah. Yeah. All right. So what would you tell your grandkids if they wanted to go into medicine? So many doctors try to encourage people not to take that path. What would you say?
I still love what I do every day. I'm in the office 3 days a week, at least part-time, and my share of weekends and evenings. And it's so rewarding, especially pediatrics, to have a patient and really make a difference in that person's life. I think the society has to look at some of these systems and make some changes. I think that medical students graduating with $400,000 in debt is not sustainable, and it's not fair. You're giving away, the large part of your 30s where you could be earning income and certainly starting your life, and you're giving that away. And then you come out with this debt that saddles you with the inability to do the things that you might otherwise want to do for another 20 years. Like, that's just not fair. My son went into business. And, if you're going in to make money, that's definitely the place to go. So I think that needs to change. And I think as a society, we need to start paying a little more attention to children, right? Yes. It's not more than 50% of our children are on Medicaid. And, Medicare is this amazing system, and Medicaid is this patchwork of state programs that are so insufficient for what we need. And again, we're building the future of America. That's right. And it's like, well, maybe they'll get care, maybe they don't. And you and I know the burden of mental health and how much COVID exposed the inequities in our system. So I think all that needs to change, but we also need physicians to do that. Right. And so if my kids wanted to go into medicine, I would absolutely encourage them. I think you lead a wonderful, meaningful life. I do think the residencies and the medical schools need to spend a little time teaching our physicians how to function in the world. It's not just medicine, right? A lot of doctors are going and getting their MBAs, but then they're not practicing. Right. I'd like there to be a path where people can practice and still make a living and still support the infrastructure of medicine, because that's what we need. We need physicians making decisions. And our subject matter experts at Allied will tell you every day how the fact that they're able to collaborate with a physician as they make decisions about this medical practice is just so valuable. So we need more physicians who are willing to do that. Yeah, that's great. All right, Kerry, thank you so much for joining me. Tell people how they can reach you if they want to either join Allied or just reach out to you. If they go to the Allied Physicians Group website, which is alliedphysiciansgroup.com, I believe there's a way to join us. They're welcome to contact me directly through email. I'm kfierstein@alliedphysiciansgroup.com. All right. So thanks again. That's all for today. Thank you, Kerry, for joining me, and a great big thank you to the listeners for choosing to spend your precious time with us. And I hope to see you again for the next episode of Reinventing the White Coat. I also want to say they could contact you, and you're always able to get in touch with me. Very true. Thanks, Jen. Thank you. Bye-bye. That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.